Welcome back. You're listening to another edition of Your Appointment with Jackson. Each day when babies are born in Miami, the parents can make a decision about what to do with the umbilical cord. That's right. At Jackson Memorial Hospital, parents now have a critical option when their baby is born. They can decide to donate the blood from the umbilical cord to LifeCord.
And I always have a story about what we talk about.
Yeah,
my neighbor did something like this, but I think they're paying a ton of money, and so, we'll talk about that. Mm-hmm. Joining us today to share more about LifeCord is Ms. Megan Arthur, Cord Blood Manager, Outreach and Collection?
Yes.
Perfect. Welcome, Megan, and thank you for joining us.
Thank you for letting me be here.
Also joining us today is the LifeCord Ambassador, Ms. Devon Vickers. I'd like to say welcome.
Thank you.
We probably could figure out some stories because we know her parents, Milton and Joe.
Parents too long. Right? That means I've been around too long.
Common occurrence.
Yeah.
Well, I'm not going to hold it against her. She goes to UF.
Oh, really? Okay.
Yeah, there's only.
We're
only going to say we
bleed
orange and green in here. That's what you know.
There's only one university in the state of Florida.
All jokes aside, I would really love for my daughter, who's going to be a senior next year, to go to University of Florida. So, and she's following your footsteps. She's an Ivy Rosette, so she's being groomed for the, it's a whole story here. But it's great to have you here, Devon.
Thank you.
I won't say anything.
No. So, we could go on and on. It's always a wonderful, fun rivalry. So, Megan, I'd like to just jump right in and ask you a few questions about LifeCord. And so, can you give us some history or background on LifeCord?
Sure. LifeCord is a program of LifeSouth community blood centers. And
no, you're fine. Oh. Just checking your levels, making sure you sound a little low, but that's okay.
So it's a program of LifeSouth community blood centers. It's a public, nonprofit cord blood bank. We started in 1998. We currently have 10 collection sites over Florida, Georgia, and Alabama. And our first collection site here in Miami was at Jackson Memorial Hospital.
Perfect. So, and I'm not even sure if this is where my question comes in, but why is it important for moms to consider cord blood donation?
Sure. So cord blood is the blood that's left in the placenta and the cord after a baby is born. And it's rich in blood-forming stem cells. And those stem cells can go to help treat patients all over the world that have leukemia, lymphoma, and over 80 other different diseases that can be treated from a cord blood transplant.
So now, of course, my story comes in. Ed's used to this. I have a story about everything. So my neighbors are paying for a service similar to this. How does that differ? I know people are probably, I want to make sure we can clarify that and the benefits of what we're talking about today, because they pay a lot of money.
That is different. So that is a private cord blood bank. And what that means is that you pay to store your own baby's cord blood for use by your family only. You pay a fee up front, and then you pay a storage fee yearly after that. Our program is completely different. It's a free program, so moms can donate the blood for free. It's stored and it's listed on the Be the Match registry, which is the National Marrow Donor Program's registry. And it can go to help cure anybody in the world that needs it. So it's not just saved for your own family use.
Well, we're talking about it, and it's a very important issue, but, having a living, breathing person who's benefited from it, Devon Vickers, tell us a little bit about your story and how cord blood comes into it.
Sure. Well, I was diagnosed with chronic myeloid leukemia, which is a blood cancer, when I was 11 years old. It was actually here in South Florida. I was diagnosed at Joe DiMaggio in Hollywood, and when I was initially diagnosed, the doctors proposed that I undergo a new form of chemotherapy, which was in the form of a pill. And gladly that worked at the time. So I went into remission and lived life as normal as possible. I went through middle school and high school, but I still kept connections with not only my doctors here in South Florida, but because once again, University of Florida has one of the greatest research centers in the Southeast. I also had doctors at University of Florida Shands Hospital. And so it just so happened one summer that I went up there. It was in 2005. They were running, normal run-of-the-mill test, and it came back that the leukemia actually came back. So at that time, the doctors proposed a cord blood stem cell transplant. And they had actually told me that when I was first diagnosed, they had almost immediately found a match, but they had stored it for me just in case anything like that were to happen. Okay. So unlike a lot of kids or adults who are on either the National Bone Marrow Registry waiting for a donor, I did not have to wait. I had a stem cell donor immediately. So I was re-diagnosed that summer of 2005, and literally less than 6 months later, in February 2006, I had my cord blood transplant.
So let's go back a little bit to define leukemia. Leukemia is a cancer. It's a blood cancer.
Yes.
Right? And what was the fear with this? I mean, obviously, the ultimate fear is, of course, passing away. But where were you with this?
Well, you're absolutely right. When can you imagine telling an 11-year-old that they have cancer? And I think at 11 years old, you really don't understand the ins and out of what that means. But I had a younger cousin who came from the islands who had a form of leukemia. And so I had to watch her undergo the several chemotherapy injections and radiation. So I actually witnessed my cousin go through all that and unfortunately succumb to that disease. So not only did I have, not an extensive knowledge of what cancer was, but I had that perception of that this is what cancer does to you, and therefore I'm going to die of this disease. Or fortunately, I had an adult form of leukemia, which is chronic myeloid leukemia, and it only affects less than 1% of its patients are children. So it was an extremely rare disease in my instance. But I think that was my number one fear. And coming to a close second was also not living life like a normal pre-teenager and teenager at the time. When you're 11 years old, your main concerns are friends, going to the movies, and sometimes family. And so that was my second biggest concern, that I would not get to finish school, that I would not get to live life like a normal pre-teenager.
Megan, let me ask you this question. Talk to me about the advantages of cord blood and what happens to the cord blood if it is not donated.
Sure. So the great thing about cord blood is that after it's collected, it's frozen and stored. And so if anyone needs a transplant quickly, it's readily available. They don't have to wait to find that adult donor and go through the process of collecting those cells. They're already ready. The other great thing is it's great for people who have an uncommon tissue type and can't find a donor on the Be the Match registry. Because the cells that are collected are so immature, they don't have to match as closely as an adult donor. So for those people that can't find a donor, cord blood could be a perfect option for them, just because it doesn't have to match as closely. And then if the cord blood is not donated, it's simply thrown in the trash. So these are cells that could have such a great impact on somebody's life. And if the mom doesn't make the decision to donate, they're simply just discarded.
So I certainly didn't hear this cord blood request or thought almost 20 years ago when my son was born. So it wasn't something that was happening back then.
No. So we started in 1998. So we have not been around that long. This is something that's still newer, and there's still a lot of research out there about other things that it can go to help. So there is research going on now. There's currently over 80 different diseases, but there's currently research going on about how it can help with heart disease or diabetes. So it's just a continual process of research, and I think there's going to be a lot more applications in the future.
So if you didn't have the cord blood, again, Devon just talked to us about how terrible this disease. She watched a family member pass away. Without the cord blood, what would happen with someone with this form of leukemia? Would they be other kinds of transfusions, transplants?
I just want to give a disclaimer that I'm not a medical doctor,
I know.
But I feel like with any disease, there are always options or alternates. And in my case, I was given the first option, which was undergoing chemotherapy and taking this chemotherapy pill, if you will, which was Gleevec at the time. Unfortunately, even though I went into remission right away, and even though it was a great medication to take, and it ultimately allowed me to live life as normal as possible for those 5 to 7 years, unfortunately, it did not cure the disease. And so this is why the doctors suggested my cord blood transplant. And so I got my cord blood transplant in 2006, so I've been in remission ever since.
I having never been asked. My wife was not asked. My then wife, the mother of my children, was not asked. We weren't asked. I remember cutting the umbilical cord, but after that, it's gone. How important? What do you think people might think of when they say, "Well, why should I do that? Why would I want to do that? What negative things might they be thinking? Why don't they do it?"
Sure. One of the main misconceptions is that this is private banking. So they think as soon as you hear stem cell donation or stem cells in general, they automatically think you have to pay. So that's one thing, that if they're just not educated that this is a free program, that they may say no ahead of time. Also, people think that when you hear stem cells that we're going to clone their babies, or that their information is going to go into a government database and your confidentiality is going to be breached. That's all not the case. So a lot of it is just misconceptions about it. They just don't know about it. Usually as soon as you talk to a mom and you explain the program, you explain what we're doing, most moms come back and say, well, sure, why wouldn't I do that? It's just the education up front that most moms just don't even know it's an option.
So is this something that's difficult, painful?
Not at all.
Okay.
It's a very, very simple process. If you go and deliver a Jackson Memorial, you just let the nursing staff know that you're interested in donating. The staff will take care of everything. You sign a quick form that says you're interested. The donation is done after the baby's born. The cord has been cut, so there's no harm, no risk to the baby at all. Usually moms afterwards, if you ask them about it, they never even knew that it was happening. So they don't feel anything. It's painless, harmless, and it's free.
So now, Devon, what would you tell a mom? We talk about you being an ambassador for LifeCord. What would you tell a mom who's expecting?
I would definitely tell the mom, because I don't get the opportunity to thank the mom that ultimately saved my life, this is the type of medium I use to get or raise awareness about this subject. And so I would definitely tell the mom, I think beyond words, it's just my presence and my story, because I think, going back to a question you asked Megan earlier, I think one of the biggest reasons why we don't have enough donors, or especially within the minority community, is because of two things: lack of education and miseducation. So usually when I talk to either people at my church or people in my sorority or my dad's fraternity, they did not know about this option, or they have the miseducation, which is very prominent within the African American community because of the historical things that have happened in the past regarding medical and research, things of that nature. They think if they donate or if they join the registry or put their name on any type of medical documentation, that it will get stored in some type of big database and used for some type of government misconduct. So when someone like me, who is a 25-year-old African American unassuming student, tells them my story and tells them everything that I went through as far as the chemotherapy, but essentially tells them that all that stuff was worth it, and it was only because that mother donated her baby's umbilical cord that I'm able to sit in front of you all, or talk to my parents or talk to my family members and tell them that I'm here because of that mom. I'm about to finish law school because of that mom. I'm about to be able to pursue my dreams because of that mom. And so when I think, or I know that when I put it like that, and when I actually get in front of audiences that may not go on the internet and is able to research this type of stuff, that when they see a person like me, someone who might look like them, someone who might talk like them, someone who might be their daughter or niece or granddaughter, it breaks down a lot of barriers, and they're able to understand exactly what I went through and why this issue is so important, not just for, the country, but for our community.
I remember when we rolled out the program, what a lot of the talk too is about some people can't find a match for a bone marrow transplant. They need a quick transfusion. And I think there was a young man that you talked about who was waiting and didn't make it. Mm-hmm. And so, you've seen the devastating results of this. And you mentioned the minorities. It's important to have more and more minorities doing this.
Yeah, Megan, talk to us about the importance of having the diversity when it comes to banking cord blood and.
Sure. Well, when we talk about matching on the registry, we're talking about tissue type, and you're most likely to match someone that's of your same heritage.
Okay.
And so we know now that on the registry, a Caucasian has about a 97% chance of finding a match on the registry. However, an African American only has a 76% chance of finding a match. And that's simply because there's not enough African American donors on that registry. So the goal is to make the most diverse registry possible so that no matter who's looking for that match, that they have that option of finding it.
So this is not a matter of, well, this is a matter of not having the enough is the discrimination part. That's the imbalance. The imbalance is just not having enough. And is the outreach is just getting to this community, or is there a need for Devon to tell more of her story in this community? What's the hold up there? What do you think the problem is?
Well, I think that's why we're here at Jackson Memorial, because we know that what better place to find a very diverse community besides Miami. So that's why we're here, and we're hoping to spread the word among the African American community, the Hispanic community, and just educating them on the importance of this. And we know that Jackson's the place we need to be to start collecting enough units to get on that registry to make a difference.
Yeah, and I want to go back because there are probably some hesitant people out there. Remember when my sons, they call me a dinosaur, came up to me and said, "So, Dad, are you have you donated your organs? After you, is it on your license?
Yep.
And I had to look, and I know I did it. I just couldn't remember, and there it is on the license plate. But a lot of people don't do it. I mean, there's this hesitation, across the board. There's a hesitation, and as you said, I can see many mothers saying, well, why wouldn't I do it? But how do we reach that group that, we should just have everybody doing it? And why isn't everybody?
Right. And I'm going to go back to what you said. If you had known 19 years ago, you probably would have made the decision. My daughter's 17. Of course, I would have jumped at the opportunity. We walk, by the blood mobile every day. That's something different, but it's similar. You're giving it for the greater good. You may not need it, your family may not need it, and if it's just going to go in the trash, it's the umbilical cord. So you have your work cut out for you. But
it is hard. It's just that education. And the thing with cord blood that's different than anything else, even giving blood, is you don't even have to take any time to go anywhere. You don't have to feel a needle. You don't have to feel pain. It's completely painless and harmless, and you don't even know it's happening. So it just seems like so much more of an easy decision than you have to physically make a decision to go donate. Or if you're an adult donor, you never know when you're going to get called and if you're going to be able to go do that. But with cord, it just seems so simple.
So there are only about 5 FDA licensed public cord blood banks in the country. And so why is being FDA licensed important?
Yes, so we were the 5th that is licensed in the nation, and we're the first in the Southeast. And what that means is that we do follow very, very strict guidelines put forth by the FDA so that moms know that their cord blood units are of high quality that are being put on the registry, and that's great for transplant centers to know, is that these units that we're putting on the registry are meeting all of these strict guidelines. So they can count on that unit as being a quality unit for a transplant.
Wow. So have you seen, is this on the uptick? Are you seeing a larger number of moms agreeing to this since you've started it being at Jackson?
Yeah. We're starting to get more and more moms as we start to educate the community more. Okay. Now that we've been there since November.
Okay.
So it's still new to a lot of moms. So we're really trying to get out in the area community, being on shows like this, just working with the clinics and where moms are going for their prenatal care, just to let them know that this is even an option that's out there.
So I'm going to say, as a spokesman for Jackson,
yes, sir,
and having no
he's pulling rank right now,
and having no shame,
and being the only guy in the room,
and having no shame,
yes,
that this sounds like another good reason to have a baby at Jackson.
Oh, absolutely.
Agree.
Well, I thought you were going to stop before you said Jackson. I was like, another good reason. No, the nest is almost empty.
No. But if you're going to have a baby, I have a baby at Jackson. Help. And I'm thinking. We were just talking to Pastor Kelly about spirituality, and I'm just thinking about my walk. And it seems that the more I do for others, the better off my life seems to be. It seems like if I keep my money in my pocket, I'll be better. No. My pastor used to say to me, "Go, you're feeling bad. Go help somebody else.
Yes,
then you'll feel better." But I wanted to make this clear too. If you do come to Jackson Memorial, it's not a matter of they're going to come around to your bed necessarily, because this is a part of pre-registration. So we make it very easy for you. Tell us about that a little bit.
Yeah, so when you check in, hopefully we've already educated you ahead of time, so you'll already know to tell your nursing staff. But also when you arrive and they're doing the normal admission paperwork, the nurses will ask you either, are you a cord blood donor or would you like to become one? And then they'll simply get out the yellow consent form that we have, and they'll have you sign off there. And then from there on out, the nursing staff will just take care of it. And then we do have health history questionnaires and paperwork that we need filled out. Moms can come to pre-register with us anytime after 32 weeks. So if they'd like to do that during their clinic visits or, come make an appointment with us or mail it in, do it online, that's totally fine. Otherwise, we'll catch moms afterwards, and we'll make sure that they get those health history questionnaires filled out.
So now, I know the number of moms who've done this are in the hundreds, but I just want to, again, turn to Devon. You said you had a donor already. You already had a match and everything. But, here's an opportunity to do something to save a life. And, when our children are born, we're so blessed and thankful that they're healthy, but we never know what's going to happen, later on. And they actually start out their lives by planting a tree, as it were, and, putting something away, maybe not for them, but for someone else. You're just going to feel better about it, I think. Devon, and as you said, you've seen people pass from these, terrible diseases who could have been helped. Unfortunately,
I have, and I think the biggest thing to take away from this, and one thing that I've definitely learned through my walk and through my experience, has been, it reminds me of this quote that I've heard, and I think it rings so true in this situation, and that's a quote from Martin Luther King, and he said that whatever affects one directly affects all indirectly. And so in my journey, in my experience with, from my diagnosis with leukemia to getting this transplant has been, I think it would be safe to say that no one in my family, and probably majority of my friends or family friends, had heard of stem cell transplant or cord blood transplant in its correct, true form when I underwent this procedure in 2006. But it's because that when I went through this procedure, my family wasn't shy about it. We were vocal about it. My parents told our church members, I told my sorority sisters, my sisters and brother told their friends. And so now each one of those people has affected at least one other person. Because, as much as LifeSouth and Megan, they can only do so much. And we know within the African American community, it all starts in the home. So it's going to start with your mom or your friend or your sister or your granddaughter telling you, this is something that you need to do, because I heard of a student or a girl named Devon Vickers who's here from Miami who underwent this procedure and it saved her life. So I think by telling my story, it's going to hopefully affect and connect with people in Miami-Dade County, and hopefully it can make Megan's job just a little bit easier. So when these mothers step foot at Jackson Hospital, they know, oh, I heard about this girl on the radio, or I heard about this girl that my sister knows, and her life was saved through cord blood transplant. How can I donate? How can I be a part of something like that? So I think that although it's our job to raise awareness about this subject, I think that it's all of our responsibility, because unfortunately maybe one day this could hit closer to home.
Well, I don't think they could have picked a better ambassador. I remember hearing bits and pieces in the story. I have, like we said, we know the family, and you've just grown up to be an amazing young lady and a wonderful spokesperson. So I think you guys have the right person.
I agree.
And we would love to have both of you back.
Thank you.
Really, we would love to have both of you back in the very near future. So now, if people are interested in contacting you, Megan, to find out more about LifeCord and how they can take the next step, where can they reach you?
Sure. Our website is www.lifesouthcord.org. And then they can also call our 1-800 number, 1-888-795-2707. Or they can call our local staff here at Jackson Memorial at 305-585-3679.
Perfect.
Beautiful.
Ed?
So we're talking free, we're talking painless, and we're talking life-saving.
Yes.
See, I'm the reason they have compliance and regulation, because I would clearly be like, okay, I'm working, this could do something good. Okay, that's me, going rogue. You're listening to another edition of Your Appointment with Jackson here on AM 1490 WMBM. Megan and Devon, we'd like to say it has been a pleasure having you as our guest today.
Thank you. The pleasure has been all ours.
Thank you both for sharing such important information about LifeCord, the LifeCord initiative. Ed, I'll see you next month. Same place, same time.
Next month, same time.
And to you, our listening audience, today you've heard lots of useful information. Please make sure you take the time to share it with your family, your friends, and your loved ones. We thank you for making the time for your appointment with Jackson. Jackson Health System, miracles made daily.